Good evening, everyone. My name is Dr. Dhananjaya. I am a senior consultant nephrologist and transplant physician. Today's session, we will be speaking about chronic kidney disease and pedal edema. Kidneys are vital organs in our body. They serve very important functions. The functions that are served by the kidney are removal of waste materials from our body, removal of excess fluid. It helps in maintenance of blood pressure. It also helps in maintenance of electrolyte balance and acid-base balance. Kidneys are also responsible for keeping our bone and teeth healthy. Coming to chronic kidney disease or otherwise known as CKD is a disease which results from permanent damage as well as irreversible damage to the kidneys because of various causes. The chronic kidney disease usually progresses through several stages. We classify chronic kidney disease from stage 1 to 5 depending upon glomerular filtration rate. Glomerular filtration rate is a calculated value that is based on serum creatinine, which is a simple blood test which we get from the lab. So chronic kidney disease stage 1 means the GFR will be more than 90, but with the risk factors like proteinuria or pre-existing other kidney problems like structural problems. Chronic kidney disease stage 2 is GFR between 60 to 89. CKD stage 3 is GFR between 30 to 59. CKD stage 4 is GFR between 15 to 29. And if the GFR is less than 50, we call it CKD stage 5. When the patients reach CKD stage 5, that is when we begin renal replacement therapy or simply dialysis or kidney transplant in such patients. So chronic kidney disease patients manifest by various symptoms. But the most commonly what we want to know is that chronic kidney disease is a silent killer. Many of the patients may not exhibit any symptoms, and an high index of suspicion is required to diagnose chronic kidney disease patients. The various manifestations of the symptoms that occur in patients with chronic kidney diseases are swelling of the ankle or feet, otherwise called pedal edema, nausea, decreased appetite, vomiting or vomiting sensation, high blood pressure that is difficult to control by the use of multiple drugs, generalized itching, decreased sleep or excessive sleep, and altered mental state. These are some of the symptoms of chronic kidney disease patients. When the patients have kidney disease, then they may develop pedal edema. I would like to talk something in detail about pedal edema, which is our topic of discussion today. Pedal edema is a word that is used to describe swelling of the ankle or feet. In kidney disease patients, the pedal edema may result from either loss of protein in urine or because of impaired kidney function. If the patients lose significant amount of protein in urine, we call it medically as nephrotic syndrome. In such patients, the loss of protein results in decreased protein in blood vessels. Then the blood vessels will become leaky and the fluid leaks out into the tissues, and that results in swelling of the tissues. In patients with kidney disease, we can diagnose this pedal edema by looking at the swelling of the feet or ankle or facial puffiness. Also, we can diagnose by looking at the skin will be stretched and shiny in these patients, and upon pressing, there will be pitting, which comes back to the original shape after some time. So patients with pedal edema, we can relieve pedal edema by following simple remedial measures. We should cut down salt. Limiting salt intake is the most important step. The salt will be high in all processed and canned foods, hence we should avoid them. Also, we should stop taking extra salt in the form of pickles, papads, etc. So second thing is the doctors sometimes prescribe a class of medications called diuretics to decrease pedal edema. So these diuretics act on the kidney and they act on the kidney and cause excretion of fluid and electrolytes from the body. So this drug should be taken under medical supervision, because if we use it in excessive dose, there will be a lot of waste of fluid from the body, which results in decreased blood pressure, giddiness, and other symptoms. This also results in electrolyte imbalance in terms of low sodium or high sodium, low potassium or high potassium. Hence, they should always be used in consultation with the doctors. We can also follow some home remedies for decreasing this pedal edema. The most useful home remedies are elevating the legs above the level of the heart. For this, we can keep 2 to 3 pillows below the legs, or 2 to 3 times a day, or we can lower the head end of the bed. So this decreases pedal edema by causing return of the fluid back to the body and the heart. We can also use compression stockings. These compression stockings will decrease edema, but using this for a long time may cause discomfort to the patient and sometimes may also cause pain. But these are important home remedies that one can follow at home. The most important point I would like to stress is pedal edema and facial puffiness are important symptoms of kidney diseases. If one has these symptoms, he has to immediately go to their family physician, or they should visit a nephrologist for a detailed checkup of their kidneys and kidney evaluation. Thank you.